guys, it's Ashley with Baby Wearing International of Knoxville, and today I'm going to show you a really simple little trick to get your baby on your back in a buckle carrier. I'm going to be using my Kinder Pack. This is my Kinder Pack. My baby is 7 months old. He's sitting completely unsupported. He's starting to crawl. It's very important when you're doing back carries in a soft structured or buckle carrier that that they fit those criteria. They're going to naturally sit a little lower in this kind of carrier on your back, so you really want them to be a little bit older and bigger before you attempt back carries. Back carries in a soft structure carrier can be very intimidating at first, so this trick is going to really help because baby's actually going to be completely buckled into the carrier when we move them around to the back, so you're going to feel like your baby is secure and well supported. So every time I put my buckle carrier on, I kind of inspect it to make sure that everything is intact. None of my straps are twisted or loose. My buckles aren't cracked or broken for some reason. This is very important because all of these buckles and straps are bearing the weight of our baby. So we want to make sure that everything looks good before we put them on. All right, now I'm going to put my carrier on my front. And I'm going to start off with everything on the loose side. Not too loose that your baby doesn't feel well supported, but loose enough that we can move around. In our waistband, I want to be able to shift this around, and I want to be able to get my arms in and out of the straps, so I just want them not as tight as I would have them when I had my baby in there. Okay, I'm going to grab them up. Come here, dude. All right. Okay. I'm going to sit him in the carrier just like I would if I was going to wear him on my front. Pull this panel up on his back. Hi. Get my clip back here buckled. All right. Now the reason that I need a little bit of room in the straps and whatnot is because we are going to walk like an Egyptian. That's what this is called. So my left arm is going to come up, walk like an Egyptian, and my right arm is going to go, I always need this one a little bit looser than the other one. My elbow is going to go through this side. Even a little looser than that. There we go. So I can get my elbow, my arm through here. So walk like an Egyptian. And then from here, all I need to do is shift my baby around to the back. So I'm still supporting his back and his bottom. I don't want to have him just completely flopping around back there. But I'm going to grab this strap right here and just bounce him around to my hip and just gradually work him around. And then once he gets to this point, I just want to flip my arm until I get him to my back. Okay, and then once I'm here, I can put my arm back through the webbing right there, and this one back through here. And now he's in a normal position on my back. He's just a little loose, so I like to hop him up a little bit higher. Sorry, buddy. And tighten that up. Tighten up my straps. And then lastly, tighten up my chest clip just to get this all in place. All right, and that was really simple, getting him back there. And then, of course, what goes up must come down. So really, we're going to do the same exact thing if we want to get him down, or if we want to shift him back to the front. If baby's on your back and they want to nurse or snuggle or they're sleepy or whatever, then you can just do this to shift them to the front or to take them down. So I'm just loosening everything back up the way it was. Put my left arm up through the top again, my right arm through the bottom, and now I can just kind of grab this strap. I'm not pulling on the strap really, I'm actually kind of pushing him with my right arm too to shift him around. We want to be really careful with the clips that we're not putting too much weight and stress on them, since those are really the most important part safety-wise of these carriers. All right, and now he's back on my front. If I was going to keep him here, I'd just tighten him back up. So, all right. Simple little trick to get your baby on your back. Walk like an Egyptian. Give it a try and see if it helps you. Thanks. Bye.